Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we are going to be talking about a specific trauma therapy called EMDR. And a couple weeks ago, we talked about what trauma was. And today we're going to talk about some of the other options to navigating trauma when our kids need more support. So we have a guest, Chris Brown, and he is a clinical social worker and an EMDR trainer and an EMDR certified therapist, and he is going to be teaching us about EMDR and why it's important to help our kids navigate trauma early in life. With that, let's get to Chris.
Yeah, glad to be here.
Yeah, so
Thanks
we're
for
going to talk
inviting me.
about trauma therapy today.
hmm
And you are an expert in EMDR, but there's a lot of trauma therapies out there. So what is the goal of trauma-based therapy?
So, I guess in order to explain the goal, it's important to understand just the general role of trauma in the nervous system.
Yeah.
When we're exposed to traumatic events, whether it's a singular event or sort of a stressful traumatic environment for an extended period of time, and the word trauma can be sort of charged. Really, we're talking about anything that creates an excessive amount of or overwhelming amount of distress in the body, in the nervous system, in the brain, that can lead to fundamental changes in the way that our nervous system is hardwired. And these changes tend to lead to a more extreme response to environmental stimuli. Triggers, reminders of those stressors or traumas tend to really activate the fight or flight response. And so when it comes to the goals, typically, I guess you could think of it in two fundamental goals that are kind of working in tandem. One is to help the nervous system kind of desensitize or rewire back to a more, I guess, state of equilibrium, and two, to perhaps develop new ways of thinking or perceiving, maybe challenging patterns that are not helping in navigating present day stressors. And so when you combine those two things together, it can lead to some really promising trauma outcomes.
Yeah. So I think what I heard you say is we really want to, because we can become hyper vigilant when we've
Mhm.
had trauma, and so hypervigilance would just be that we are having a bigger reaction to that thing. We're looking for the danger constantly, and that can be
Yeah.
exhausting, especially when you're a kid and you don't understand what's happening. You can be super irritable. You can be really tired and sluggish. You can have headaches. There's a lot of symptomology, right? So we have a lot of
Yeah.
stomach aches, like physical complaints, but then it's also hard to focus at school. It's hard to do the things that you would like to do. And so
Mhm.
the goal is to get kids back, or teens or adults, whoever it is that's doing the therapy, back to a comfortable place for them to be able to be in their life, to like be in the moment, to be able to live their life without being brought back to that trauma place. Did I understand that right?
Yeah, that's a good summary. And I guess I would add one of the other potential signs or indicators is around sleep.
Mhm.
Bad sleep, nightmares, if things like that become more prevalent. In my world, sleep presenting sleep issues are often an indicator that there's not enough space for the brain to work through the traumas during the day.
Mhm.
And so it shows up at night when it's got a chance to try and resolve things. But what that can look like is really bad sleep, nightmares, and that can feed into all the challenges that might present themselves the next day. When we're
Yeah.
not fully rested, it can lead to a lot of issues.
Yeah. Well, and sleep is just so important for our brain, even without trauma. But then when we
Yeah,
add in that component of trauma, and I think it can cause parents to have a lot of frustration when their kids' sleep is disrupted because then it disrupts the parents' sleep. So sometimes kids are presenting and no one's aware that a traumatic event is the thing that is the underlying cause. So sometimes
yeah,
there are traumas that we're not consciously aware of, where we don't realize it happened or our kids didn't put words to, but we're
yeah,
seeing the somatic complaints, the body complaints, right?
yeah,
And then that might be something that you would bring to your pediatrician to say like, hey, we're having all these issues. We don't know what's causing them.
yeah. Well, and just to kind of hit on how to understand the events that might activate this, you know, again, trauma, it can be a really charged word, but with kids, it could be, the most extreme things that we might imagine, certainly, but it could also be, getting bullied at school or getting attacked by some kid at school that, didn't really know how to use their body appropriately, or, a close family member, caregiver, that has to leave the home for work all the time. There's really anything that's triggering a sense of, or a lack of felt safety or control can potentially lead to these nervous system changes. So I think it's just important to be aware that, like, there's a lot of things in life that can start to look like the nervous system is affected by trauma.
Hmm.
In the EMDR world, one of my favorite trainings, they refer to this stuff as pathogenic memories.
Hmm.
So anything that you can remember that has created some kind of challenge or distress in the body that has led to some type of pathology, some symptoms.
Hmm.
Anything along those lines is in the EMDR world is fair game for being targeted with EMDR.
Hmm. So let's talk about like what options are there for helping people navigate trauma, specifically kids. So there is EMDR, which you've mentioned, and we'll get more into what that is. But like, what are the things that we look at in terms of like what choices are there for navigating trauma for our kids?
Hmm. Well, with kids, I mean, personally, I have some experience working with kids, adolescents, teens, and at a certain age, it starts to look really similar to how I treat adults. But the most researched, heavily, focused options would be CPT, cognitive processing therapy, which is, really focused on the way we think and perceive about things,
Hmm.
and, a lot of Socratic dialogue to kind of help people reconsider and challenge ways of thinking. Prolonged exposure, which is, recounting the the traumatic incident over and over again until it becomes desensitized.
Hmm.
And then EMDR, which we'll probably talk quite a bit about, but essentially it's a tool to target the root cause stressors that have led to the symptoms in the first place, to help give the nervous system a chance to kind of reconsolidate the way that memory, that experience is stored, and develop more adaptive ways of thinking and being. But even, emotional regulation tools and techniques, kind of mindfulness based interventions, can go a long way as far as symptom management. They're not necessarily the best for long-term resolution of the underlying issue, but for some people, symptom management is, like, over half the battle. And
Sure.
once they get a sense of that, things become a lot easier.
Absolutely. Okay, so with that, let's talk about like what is EMDR and what ages can do it and how does it help?
So EMDR, it's an acronym, it stands for eye movement desensitization and reprocessing, which essentially means we are using the left to right, you're following, whether it's, the therapist's fingers going back and forth, or, we have light bars that can facilitate that. So therapists who do this all day don't end up with tennis elbow.
Yes, yes.
I'm a telehealth provider, so I send people a link where it happens on their screen. But really what we're doing, and sometimes we also have like auditory where while the dot's hitting the left side, the ear's beeping on the left, and then tactile, you're holding pulsars in your hands that will vibrate when everything goes to the left or the right.
Mhm.
And so we're trying to facilitate what we call bilateral stimulation in the brain and the nervous system. And from what the research has shown about bilateral stimulation, what's happening is it's doing two things at the same time. One is activating the hippocampus, the part of the brain that like stores memory. And so you're able to real vividly look at memories that normally aren't as easily accessible. And two, it's suppressing, not entirely eliminating, but it's suppressing the fight or flight switch, the amygdala, the part of the brain that like really activates the strong symptoms. So if you could imagine both of these things happening at the same time, you're able to look real close at difficult memories, recall them more vividly than you might normally, while also having a lessened nervous system reaction to whatever it is that you're looking at. So what we call it is the window of tolerance. It opens up the window of tolerance and allows somebody to do really deep, thorough, efficient processing work, looking at thoughts, feelings, emotions around stressors. And when they look, one of my favorite studies to highlight this is Pagani and et al. Oh, there was a lot of people on the study, but they took pictures of the brain before and after EMDR and asked somebody to recall the same memory both times. And before EMDR, the part of the brain that's lighting up was like right in the center, the right where the primitive brain is, the fight or flight switch. Like the traumatic memory is right there next to it. So whenever it is recalled, it kicks on that fight or flight switch. But when they looked at it after EMDR, it was now stored somewhere back in the cortex away from that fight or flight switch. And so we use the term reconsolidation. It helps reconsolidate memories and fundamentally store them in different parts of the brain that are going to be less likely to activate the difficult symptoms that people struggle with.
Mhm. And why is that important? Why does that matter that it's moving it around?
Well, if it's being moved around and it's no longer right there where the fight or flight switch resides, the things that you go through in your day to day that might have previously been triggering these difficult emotions, feelings, symptoms is no longer going to be, it's either no longer going to be there, which sometimes is an outcome, it's just completely resolved. Other times we'll see, dramatic reduction in the frequency, the severity, the duration of the most challenging, distressing symptoms that people are dealing with. And this is like a long-term, this is a long-term solution. And one of the studies that I also used to keep on my wall at my old office was looking at SSRIs versus EMDR and the outcomes it could have in symptom reduction. And in the initial survey, like the immediately after treatment, they both had a similar reduction in symptoms. EMDR was a little better, but in the 6 to 12 month follow-up, the SSRI stayed the same, but the EMDR kept improving.
Mm,
And I think it's a really good that was a really good study to show that what your brain does during the process of EMDR, the brain learns how to do this in a more adaptive way, how to deal with stress in a more adaptive way, and it can continue to support you into the future.
absolutely. So, what ages can do EMDR?
All ages, as far
Mhm,
as I know. I mean, I know that there are EMDR specialists who work just with kids,
mhm.
And, I've done EMDR from, I think the youngest was around 7 years old into the 70s or 80s.
Hmm.
Across the lifespan, EMDR can be supported. And if you think about it, this idea of bilateral stimulation supporting the nervous system, if you look at, you know, the historical human experience, being in tribes, having dances and music groups like drums banging on both sides of the circle, bodies moving left and right, dancing. I think there's this sort of an evolutionary aspect of this bilateral stimulation that is therapeutic for people.
Hmm.
And I remember talking with somebody about vision quests where people get together and, talk about something that they're trying to resolve in their life. And then they go on a hike and they go and, go somewhere in isolation to just sort of sit with themselves for a while. But in that journey from that circle to where they're going to be in isolation in that hike, when you're hiking, your eyes are darting back and forth and you're kind of looking left and right at everything around you. And that's actually how EMDR was discovered by Francine Shapiro. She was dealing with something stressful and on a walk in a park and realized that she was starting to feel a little better and that her eyes had been darting left and right the whole time. And that was sort of the initial hypothesis. So, this is something that can help all humans and it's used across the globe. It's not unique to Western culture either.
Yeah. Well, and I think even for me, like I think about, so I'm an EMDR therapist as well. And to be honest, when I first heard of this, I was like, no, I'm not interested. Like this just sounds like magical. No, thank you.
Yeah.
And then I needed some continuing education. So I was like, okay, fine, I'll do it. And then I was totally convinced, right? Like even within the training, you go through EMDR therapy to become somebody who can provide EMDR therapy, which I think is an important part of that therapy to understand what it feels like, what it's like to go through that piece. But I was
Yeah.
like, oh my gosh, like this is amazing. And also it helped me to recognize like when I'm feeling stressed about something, going for a walk helps me. Right. And so it was like, oh yeah, I already align with this. I just didn't know this method, right? I understand like, those things help us in different ways. It's not just about the bilateral stimulation, right? Excuse me, but
Yeah.
it's also about that piece. And it's so important. And I think it's hard for us to recreate that in our lives to the intensity that we need to resolve some of the trauma in the way that we live life now, right? Like you said, that there were ways that in past cultures, even within the United States, that they would do, different tribal dances or things like that and music and those things to help people. But like it seems like the when life is simpler, they figured out ways to do the things that we're just figuring out again, almost, right? They
Yeah.
they had solutions to things that we're just now refiguring out. So what
Yeah.
positive results have you seen from people with trauma using EMDR? Why do you think do you feel like it's a really effective method? Like,
Yes, absolutely. Um, I'll try to, I mean, I have a lot of examples. Most are adults, so I'll try to think of some with kids. One kid had broken both of their wrists and doing a sport activity that they really enjoyed. And there was concern that like they wouldn't be able to have fun doing this thing again once they had healed. And we did EMDR on the actual incident that led to the injury. And when we do EMDR, we check SUD, like we call it the SUDS level, the subjective unit of distress scale. 0 would be doesn't bother me. 10 would be this is the worst thing ever. And I think when we started the SUDS, it was like a 8 or so. And we did EMDR targeting that initial, incident that led to the injuries, and then kind of instilled this rehearsal of, you know, when you go back there again, what's going to happen, kind of a thing to address the anxiety. And when we finished that day, I think the SUDS was down around a 3 or a 4, but when we checked in again, it was the first thing they said was, "It's at a 0 now."
Mhm.
And then, I think it was a couple months later after the breaks had healed, they went back and performed this activity again, and the reports were like, this is all good. There was no issues. They're having fun, and it wasn't even a problem. Uh, but I know from that sport and those kind of injuries that that's not always the case for kids. Like, it can lead to them not going back and finding something new or different. And this is something that in the EMDR for performance enhancement is used and talked about a lot. A
Mhm.
lot of athletes can use it to support, being able to continue doing the thing they love and actually still enjoy it. Another example, I think I sort of alluded to it earlier. There was an incident at school where a, a child had like choked another child. Was the child that was choked was probably just playing around and not really aware of their body. This is a really young age. I think like first kindergarten or first grade. But the kid who was attacked, like, is the first time in their life where they like thought they couldn't breathe, and it led to that dump of chemical and electrical signals that says like, hey, this is not okay. Our bodies are in jeopardy here. And that fight or flight activation led to, started to see anxious tics and, other symptoms that the parents were concerned about. And so targeting that incident with a little kid is a little more challenging than an older child or adults. And there are, therapists who will use, like little finger puppets, like follow the character on my fingers and just focus on that thing that happened. We have specific questions that we use to help anyone, kids, adults, really focus in on the memory that we're trying to address. And so, you ask the kids to focus on that while they're following the bilateral stimulation. And with kids, it's really interesting because they're not they're not processing and reporting back like adults do, but you can still see and track their movement and progression, and there's actually resolution much quicker with children than there is with adults because there's just not as much crap that gets in the way, right?
Yeah.
They have young lives and their brains are still forming, and they just don't have all the baggage that adults do.
Mhm.
So EMDR for kids actually can be really efficient and effective. So those are a couple examples. I don't know if.
Yeah. Yeah. Well, I was thinking I've had kids that I've worked on like car accidents with, right? Or
Mhm.
being at a place where a shooting happened or something like that, where we've worked through that. Or sometimes the kids are not at the place. I've had kids who have a parent who was in a traumatic situation, and it's like vicarious trauma, like they've absorbed what their parent went through,
Yeah.
um, and we've worked through that. So I think EMDR can be incredibly effective. Some kids don't tolerate it, but I find that that's actually less of what happens than do tolerate it. Most kids are able to navigate, and having all the play therapy training that I have too, that we can incorporate really easily the EMDR into a more play-based activity. And I like
Yeah.
the buzzies with the little kids, which is just the vibrating part. And we'll
Hmm.
like put them in their socks or their pockets or whatever. They don't necessarily have to hold them, which allows us to like do drawing or other things at the same time. So there's definitely
Nice.
creative ways that we get that done. And I have seen also really super positive results where it's like talk therapy or just even cognitive behavioral therapy would not have gotten to this outcome,
No.
maybe ever,
Yeah.
or this quickly, right? We're able to kind of navigate through. And I agree, their neural network is not, they don't have as much experience, right? And so, and when we treat trauma early, when we intervene, it doesn't get to kind of wind itself around other memories and cause that, lack of safety, lack of control feeling, in
Hmm.
so many settings. And so I think
Yeah.
responding quickly is probably the most ideal to those
Well,
traumatic. things.
And just quickly, anecdotally, for the parents and adults who watch this, I work primarily with adults, but majority of the time, at some point in that EMDR journey, the work that we're doing is targeting that little child within them that went through so much pain or stress or trauma. And so it's like if you don't let your kids deal with it now, at some point in life they're going to have to
Mhm.
figure this out and resolve it and heal from it. And this, I think this kind of leads to like that whole case of mental health should be viewed like any other healthcare. Like we all should be pursuing mental health to some degree. It's a very, I think, very small portion of the population that would go through life without any stress or trauma, right? Like it's everywhere.
Yeah.
I don't know. I honestly don't know if it would truly exist that nobody has endured anything
Mhm.
difficult, you know? Um,
Well, that's
so,
part of how
and
we grow, and we do have to go through difficult things, and some things that are
yeah,
difficult are not traumatic. But I think I heard a study that was, I think it was like 76% of kids by their 18th birthday have experienced trauma. So it's a lot, right? And then
wow, yeah,
think about just the amount of time after that. So it's like if you haven't done that, if you haven't experienced that by your 18th birthday, there's not many more of us who would not be in that group, right? And
yeah,
then at some point, something's going to happen that elapses your ability to cope. So,
yeah, yeah.
so why do you think parents would choose EMDR over another modality? Why do you think, what would be your thought on why that would be a good choice?
Well, I mean, my answer to that question would be the same for anyone, whether it's a child or an adult. It's one of the most efficient treatment methods that are out there. And if you're concerned about having to be in therapy for an extended period of time, or if your kid has been in therapy for a while and you're just not seeing a whole lot of progress or improvement, EMDR, it's great because it doesn't require a lot of homework, you
Hmm.
know, and that was one of the reasons I chose it early on when I was working at the VA. You know, clients that are asked to do a lot of homework, especially when it's dredging up, a lot of difficult things, they tend to not follow through with the therapy, and they'll just drop out because it's like this is too much for me, and you know, doing it at home, I don't have the support. And with EMDR, you don't have to worry about that because it's all happening in session, and kids can enjoy their life and just do what they do outside of sessions. And you know, just as a quick, I guess, estimate, for most of the kids that I've worked with, probably two, maybe three EMDR sessions at the most was usually all they need. Adults, much more than that, typically. Adults might be 6 to 12 months. Kids might be 1 to 4 months in terms of like what they were really going to be in therapy for to get the all that they might need. There may be continued follow-ups to just kind of make sure things are tightened up, but otherwise it's much quicker. So obviously that would mean it's more affordable. You're paying for less sessions.
Sure.
But in my opinion, it's a lot more effective too than a lot of the other options that are out there. But I'm obviously very biased as
Yes,
far as
yeah.
that
And
goes.
I am frankly too. But I think there's a lot of research behind it, right?
Yeah,
People have tried to disprove the effects of EMDR against lots of other things, and they have not been
they can't.
successful. Yeah,
Yeah.
which I think is great. We love that when studies get empirically validated by another entity trying to reprove the research. And then when they do prove that what the research says is true, that's great for us because it just
Hmm.
means what we're doing is really supported by the data. And I think
Yeah.
when insurance companies do pay for something like EMDR or cover that, not everybody takes insurance, but that tells you something because they're certainly not going to pay for something that is not supported by research.
Yeah.
And so I think, there's more emphasis on it really is an effective method. And I think kids see relief, adults see relief. I mean, it's hard, right? Doing any type of therapy on any type of trauma is hard. But I do think that this type of therapy makes it a little bit more tolerable, and knowing that it's not forever. You're not going to have to keep dealing with that part forever, and or just like reducing it by 50% would be amazing. Most people,
Yeah.
if you could just reduce the symptomology by 50%, they would be like, I could totally handle this. And I've
Yeah.
seen way better results than that.
Hmm.
Excuse me. But in some circumstances, 50% is where they feel good too. So I agree on
Yeah.
that. So one thing that we kind of alluded to earlier about EMDR, is it just a trauma therapy?
No, no. Trauma is its primary use case, most heavily researched use case. The sort of original purpose was for treating trauma.
Mhm.
However, applications with EMDR have been explored and validated in treating anxiety, depression, substance abuse. It's used for pain management, performance enhancement. Um, something that myself and colleagues are starting to look at is using EMDR for like psychedelic integration support for people who have gone and pursued psychedelic healing experiences, because there's a lot of work that needs to happen after, and EMDR is really a powerful tool for that. So there's an EMDR protocol made by some providers in Germany. They call it DEPREND. It's depression and in depression protocol. And it's one of the use cases outside of trauma that's been the most researched. And the way that they talk about this is that's where I got that term I used earlier, pathogenic memories. Because the understanding with depression is it usually doesn't start in a vacuum. There's something in life that happens that will trigger a major depressive episode. And so that something in life that happens may not be a big T trauma that would lead to PTSD, but it's leading to depression symptoms.
Mhm.
And when you can go and, assess what are the things that have happened in life that have led to depressive episodes and target those specific incidences, those pathogenic memories with EMDR, it can resolve those symptoms, and it can, what their research has looked at as far as the depressive episodes goes, it could also prevent future relapse back into another depressive episode, even if something bad happens in life. You through EMDR, your brain learns how to be more adaptive and resolve and process stress in a different way than it used to, and so future incidences are less likely to be as problematic as well.
Love that. So
I don't know if
why
that
does
answered your question.
Yeah. Well, yeah, I think absolutely did. I think
Okay.
EMDR can totally be used for so many different
Yeah.
diagnoses or situations. And I've used it with like gymnasts who get like a mental block around doing a particular activity, right? To like do imagery to bring that in and imagine themselves doing that. And there's something about the bilateral stimulation that seems to allow them to overcome that hurdle in the gym. And so I
Yep.
think, using that part and seeing what's holding them back from being able to do that. I think athletes do a lot of hard, scary stuff, right? Especially gymnasts when you think about how they're using their bodies, but even football players and
Hmm.
soccer players. I mean, like a lot of the things that we can definitely have mental blocks around. And so I've seen that it's effective there too. So there's a lot of uses for it. So,
Hmm.
why do you think, to summarize, like, why do you think that treating trauma is so important, especially early on?
Summarize. Keep it short. Uh, it if you treat it early on, you're not going to have the same kind of issues that can happen when trauma goes untreated.
Mhm.
And untreated trauma can look really ugly. I mean, I personal experience. I have very well-managed PTSD at this point, but, I was in the military and served in combat theaters and came home with PTSD. And, when I was still in the military, everyone around me had it too. So it was normal and we didn't really think anything of it.
Mhm.
But, substance abuse, emotional regulation issues, which can lead to problems in relationships. You know, Working with adults, I've worked a lot with clients who have gone decades with untreated PTSD. And, not only is it have an effect on mood, nervous system, like we talked about earlier, sleep problems, relationship. I've had clients with multiple divorces because they just couldn't make it work in relationships because they were having, triggering episodes all the time and didn't even know what was going on. Substance abuse, if you have a chronic condition like PTSD and the symptoms that come with untreated trauma, a natural byproduct of that is also like symptoms of depression. And sometimes it can manifest in like physical chronic pain issues. I can't count how many clients I've had with un undiagnosable like indigestion, stomach issues, weird pains that the doctors can't figure out. And they do some EMDR, and all of a sudden, it's like, oh, how's your stomach been lately? And they're like, oh yeah, I forgot that was it. I forgot I even had that a few
Mhm.
months ago, kind of a thing. So if you go with trauma untreated, it can lead to all sorts of biopsychosocial, even spiritual, emotional issues. So yeah, I mean, the early intervention for trauma is really important.
Yeah. What I hear you saying is it doesn't go away quietly.
No,
Trauma is going to present itself in other
no,
ways and cause more disruption. Absolutely.
yes.
So, what do you want parents to take away from this about EMDR? What do you want them to remember about this conversation?
Well, I guess even though, when you think about the bilateral stimulation thing, a lot of times it sounds weird and scary. Like it's kind of a weird method to treat people. Some of my clients have called it voodoo magic or Jedi mind tricks.
Mhm.
They've got all sorts of jokes about it. As weird or scary as it might sound, it's really not. It's one of the most gentle, efficient, effective treatments that are out there, if not the most. It's in my opinion hands down better than any kind of pharmaceutical intervention might be. That's not to say that sometimes pharmaceutical interventions aren't warranted, but if that's the only option you're pursuing, you're really just putting a band-aid on things.
Mhm.
So it's one of the most effective tools at getting to the root cause issue and actually finding healing and resolution for it.
Yeah, I love that. Thank you so much for your time today. This has been such a great
Yeah,
conversation,
of
Chris.
course. Thanks for having me.
Thanks again, Chris. That was a great conversation. Thank you so much for sharing your knowledge with us and helping us to understand more about EMDR and its value in our lives, but also our kids' lives. With that, I will say thank you so much for your time today. Please rate and subscribe to our show. Follow us on Facebook, Instagram, and TikTok. And also keep the emails coming with topic suggests or questions for us to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.